Hola, bon dia. Carl Munson here with the Good Morning Portugal live stream. We're also a Facebook page, Good Morning Portugal. We are a podcast and we are a YouTube channel as well. And yesterday we decided to report on the coronavirus situation and refining that to make it a useful service to you. Thank you for everybody who chose to use the service yesterday. And the video was well circulated. So what I'm trying to do is make that as efficient and as useful as possible. Part one today, this morning, I hope to do this in 5 or 10 minutes because we've all got busy lives. We've got other things to do, but I want to give you a concise report on what's going on. I'll start with the world numbers, then the Portuguese numbers, the situation as the Portuguese government is telling people is going on and what to do, courtesy of Safe Communities Portugal. And we will have David Thomas on from Safe Communities on the show with us tomorrow morning. So if you have questions of David and Safe Communities, do join us at this same time tomorrow morning, Friday. Also, with the World Health Organization declaring this a pandemic, we just have a little look at that as well. And then we will basically look at the weather and go into more of the discussion opinion stuff. So I will publish that as two parts. So you can just have the news and updates and information as one part, the facts and figures, as it were. And I think also there is another important aspect to this socially about how we can work together whilst we are considering the strategy we're taking, whether that be for me, it is about isolation now and containment and how vigorously or how seriously we're taking that. And I think that's a good discussion to have and also good to share strategy on that. So that's kind of part two of this show today. But let's get to the numbers and the facts and figures first and foremost, because I think that's what is a good place to start and good to know what's going on right now. So let me just show you. Yeah, I've gone to this screen just to show you Portugal has now, according to worldometers.info, which appears to be a reliable source of information until I hear otherwise. That's what I'll use. Portugal, 61 total cases, one person sadly in a serious critical condition. Okay, and as we scroll up, we can see that the situation around the world is that new cases, let's have a look. Yeah, new cases, the worst hit places are South Korea, and the numbers there for the United States, Australia, China, Poland, etc. And you'll see where the highest death rates are as well. So just the overview then of the world numbers. Coronavirus, 126,420 cases total. Deaths so far, 4,636. And it's good to know that 68,314 people have recovered and been discharged from this illness. Okay, so yes, this is Good Morning Portugal, where we are trying to keep you up to date with what's going on with the coronavirus situation as it occurs, as this event occurs. And I take a broad view of this. It's not just a disease, as grim as that is, and as horrible as that is for individuals. This is an event, as far as I'm concerned, in terms of a phenomenon about how it will affect people. I am in rural Portugal, and you'll hear the sounds of the birds and motorbikes and dogs barking outside. I live in Portugal. And we're just keeping an eye on how things are developing and what we can do together to figure it out and work together to manage, contemplate, take action, be practical about this whole event and phenomenon that seems to be unfolding in front of our eyes. So let's go to the latest update from the Portuguese government. And as I say, this is courtesy of the Safe Communities Portugal. I'm doing some technological gymnastics here as I navigate the various screens that I've got open. Here we go. Look, the latest on the coronavirus outbreak. You can find this. I find this a very reliable source of information. And as I say, David Thomas from Safe Communities will be with us in the morning if you have questions of him. Latest on the coronavirus outbreak. Their latest report, based on government information, comes from 2 o'clock yesterday, the 11th of March, Directorate General for Health, DGS, announced yesterday, that the number of cases of patients infected with the new coronavirus has risen to 59. And so it's 2 more as I speak today, an increase of 18 plus the 2 more since yesterday. According to the bulletin on the epidemiological situation, there are 471 suspected cases, of which 83 are awaiting laboratory results. In addition, there are 3,066 contacts under surveillance by health authorities. The SNS line, this is worth taking a note of. I think it's useful to have. The National Health Line will be reinforced on Friday with 81 nurses to respond to the increasing calls due to the COVID-19 outbreak, the Minister of Health announced yesterday. The number you need for that is 808 24 24 24, and you press option 9 to speak to somebody in English. Okay, so 808 24 24 24, option 9 to speak to somebody in English. The National Scout Corps, and that's a very important organisation here in Portugal. National Scout Corps has suspended all national activities until March the 25th due to COVID-19. The Minister of Health told Parliament this morning that the possibility of collecting biological material at home for analysis is being studied, and that the expansion of home hospitalisation to keep patients at home is also being considered. The minister recognises that it will be not possible to contain the contagion of infections by COVID-19 for much longer, stating in Parliament that in the last 24 hours, there are more confirmed cases in Portugal, which will be revealed in the next bulletin, which we're expecting any minute, for today, the 12th of March. The Ministry of Health has authorised all hospitals of the National Health Service, the SNS it's referred to here, to reinforce their stock of masks, medicines and protective equipment, including integral suits and eye protection. The order was published this Wednesday, that's yesterday, in Diario de República. And the order signed by the Minister of Health, Marta Temido, on March the 3rd was published this Wednesday and determines the immediate increase in stocks by 20% in relation to the annual consumption registered in 2019 of hospitals and other health units in the country. SNS, it is a measure that is part of the contingency plan to combat COVID-19. Marta Temido stated that it is inevitable that we will enter the mitigation phase within hours or days because the evolution of the situation is being very fast. A decision on whether to bring forward the closure of schools for the Easter holidays, currently scheduled for the 27th of March, is expected later today. I'm not sure. You could let me know if you know on that. I think schools are remaining open for the time being, but here in Portugal, as with most countries, and as you can see in America, UK, people seem to be accelerating their responses to what's going on in response to the spread of the disease, and they're really not sure what to do, are they? But more about that in the opinion part, in the discussion part 2. So we'll finish off on the more factual stuff, and we'll go into my opinions and your opinions, which please do share in the comments. And if you're not listening to this live, do use this as a resource, the Good Morning Portugal page. And also we have a group, which I have called up until now Portuguese Positive News, which seems a little bit ironic, but I think we do have to stay positive, stay healthy, and as I say, stay close to the ground. I think isolation is a good thing at the moment. And I do think we need social networks to help us connect, to help us avoid the worst aspects of cabin fever and so on, and to adjust to a new way of life that's being thrust upon us. So yes, look, this is the BBC I'm sharing with you. The World Health Organization has declared it a pandemic now. And I think, that's kind of academic in a way, isn't it? I mean, we're more interested in how it's affecting us on a local level. I suspect that does mobilize other resources. But the summary is what I want to read you over on the left of the screen here. Just a few key points that might be quite useful in terms of updating you around the coronavirus. The World Health Organization has declared a pandemic. The number of cases in Europe continues to rise, with more than 10,000 in Italy. And I understand in Italy, all shops are now closed apart from chemists and supermarkets. Germany's leader says 60 to 70% of the country's population could become infected. That's their guess. And I'm sure they'll be responding in kind to that as well. UK Chancellor unveils 30 billion package to boost the economy in the UK, as well as an interest rate cut. And the health minister, as you probably know, Nadine Dorries, is among 460 cases currently in Britain. As it spread in China slows, Beijing is to quarantine all international arrivals. And there are now more than 1,000 confirmed cases in the United States. Major events are being cancelled there. So there you go. That's pretty much a 10-minute update for you on the news, the information, the data side of things. I'm going to just slow things down now and give everyone a chance to talk and to contribute and say what you have to say about what you think is going on, and let's make this a networking of a kind, because I think this sort of grassroots connection between people is really important, as well as what's coming from governments and the municipalities and so on an administrative, bureaucratic level. We should also be organising ourselves on a local level too.